A petition for writ of habeas corpus was filed yesterday in Tequanche County Circuit Court, and there is an effort to get Carol Getty before a different judge so she can have some relief. This is David Tulis. We argue for local economy and the free market, and I hope you're not sleepy. I hope you get a good night's rest every night. You, my listener, who is considering carefully my whimsical suggestion that you love your neighbor and buy local. If you're not getting good sleep, you may have a need for a sleep test, and that sleep test may uncover problems. The problem could be snoring. The problem could be something such as sleep apnea. Sleep apnea afflicts at least 20 million people by one count, and most of those, probably 80% of those, have a condition which is not diagnosed. And I think it affects men. We'll find out a little bit more in just a minute here from Angela Lunn. Dr. Lunn is a dentist, and she and her husband Riley run a practice on Brainerd Road. And what caught my eye about that practice was a sign outside that says we handle sleep problems. And I thought that's very unusual. I have not heard about that. And so I went in and asked to meet with Angela to see, just have her explain to me what it is she does. And there's something here of special interest to you, my listener. Angela, tell me about sleep apnea and how my listener, I'm going to take my listener as a guy here, how it affects men, I think, more than women. Is that right?
Yes, many times it is men more than women, but we are catching up to the problem. So we have two problems here, snoring and sleep apnea. That's two problems that are associated with sleep disordered breathing. There are many, many problems. Apnea is one that is can be fatal and is very damaging to your body. If it's not fatal for long term, it causes many, many problems. Some of the symptoms that you might have are sleepiness, depression, exhaustion, memory loss, loss of libido, and weight gain. And yes, it can happen in men, and it has traditionally been diagnosed more in men than it has women.
Why is that? Is there something about men's necks or gums or teeth that differs from women that causes this problem?
Well, traditionally, I think men have been more stressed. As women have entered the workforce, we're learning about that stress too. But I think that their body build, they tend to have more fat, and sometimes neck is larger.
What about you said, you told me earlier, men are often overweight, and their overweight status or their weight gain starts showing itself in their tongues. Does that affect their sleep patterns?
Right. Well, the first place that most people gain weight, and we don't know it because we're not weighing this body part, is our tongue. So what happens in a sleep disordered breathing, there's three types of sleep disordered breathing. There's mixed, central, and obstructive. And I deal with the obstructive portion. That means that your tongue or musculature in your mouth could be falling back and closing off your airway. There's other apneas that are central, and that's mediated by your brain.
And so therefore that's not one you deal with because you're a
Right.
dentist and you don't deal with brain sourced sleeping problems.
That's correct.
Okay.
And I deal with sleep disordered breathing through referrals from the physicians. I want to work with the physicians. This is a medical problem. And so I screen for the physicians to see people that possibly have this issue. And then the physician interviews them and decides if they might need a test to determine if they have a medical problem. And if they do, he sorts out which problem it is, or she sorts out which problem it is. And then they're usually referred to me. So I act as a screener for the medical community.
So the man who drives by your office, the Lunn Dentistry office on Brainerd Road, sees that sign and says, "Well, I have a problem. My sweetheart says I'm snoring, and I'm often I have dry mouth. I have stress in my chest in the mornings. I feel like I'm having a problem here." They come into you. You then say, "Well, please get a sleep test first. Here's where you can get that done through a doctor's office," and then the referral comes back to you. Is that how that works in practice?
Yes, that's the best way, because no one can tell whether they have a breathing problem on their own. It has to be diagnosed through a sleep study. We do not, we breathe during the daytime and we breathe during the evening. In the daytime, we are aware of what we are doing. we're controlling it. In the evening, we let go. Our chemoreceptors and neuroreceptors and sympathetic and parasympathetic system take over our body. So we're not in charge of it anymore directly. It's involuntary.
Now, what does your office do once the sleep study's been done, the patient is determined to have had or to have a condition of sleep apnea? What do you do next?
Well, we examine the patient if we have not prior to refer them to the physician. We examine them to determine if they are a candidate for this. Do they have the symptoms? Do they have recognizable signs like a large tongue, a tongue that has a scalloped border?
What is that?
If you stick your tongue out and you see little ridges along the side, looks like a little ruffle, then your tongue is probably too large and your teeth are holding it in like a fence. So it gets these little scalloped edges
Is that
on
like
the side.
a wear and tear on the tongue?
It's the tongue trying to escape is what it is. It's just too large. It can't go back any further and it can't get out from your teeth. So what we can do if you're diagnosed with obstructive sleep apnea and you have the correct conditions in your mouth, if you can wear an oral appliance, then we can help by fabricating this appliance, which all of them, and there are a lot of them, there are probably at least 100 out there, but all of them have the same purpose, and that is to move your mandible, your lower jaw, the jaw that holds your tongue, forward.
Now, I'm holding here in my hand for the viewer on Facebook, the viewer also on YouTube, an example. What am I holding in my hand? Angela, Lunn, describe it.
This is a piece of, well, it's a device much like, I'd say, a sports guard. So it's a plastic that fits around your upper teeth and around your lower teeth. And it's connected by a metal device that has pivots and struts on it in one example. And then another example may have elastics that connect the device, the lower member and the upper member of the appliance. So you have a lower sports guard almost and an upper sports guard, and then you have something on the side that moves your jaw forward in the evening or whenever you're sleeping, when you're laying down, so that your tongue or any other musculature does not fall back and obstruct.
So the remedy is, for my listener, if he has sleep apnea or maybe even just snores, the remedy for both of those conditions, one is a symptom, one is a real problem, is to pull his jaw forward in some way, and that's what this dental device does.
Yes.
In short.
Yes. And these devices have been around for a long time. We've used them in dentistry for different things, but apnea or sleep disordered breathing is becoming such a large problem for our country that they're coming back into popularity to try and treat this epidemic that we have of sleep disordered breathing.
Well, how long has there been a new regime in the law that allows you to do what you're doing? Is this relatively new, Dr. Lunn, in the dentistry field to involve yourself in this service?
Yes, this is relatively new, and as far as I know, I'm the only one in Chattanooga that is working with the physicians and can work with your insurance company or Medicare to help you with the cost.
Well, now say something a little bit more about your practice. You're a regular dentist, right? You have
right. We do fillings,
men, women,
cleanings,
children,
crowns,
okay.
Children, men, women. We have a general practice in Brainerd. We're on Brainerd Road, 5323 Brainerd Road. And while this is not a specialty, I have a special interest in apnea. And then my husband practices with me, and he has a special interest in TMD, temporomandibular joint disorder. So the two kind of mesh together, and it just offers another faucet for our patients to take care of their health. We would like to have more integrated health. The mouth is not a mouth alone. The mouth is only a mouth when it's attached to the rest of the body.
What is your take on CPAP as a solution to sleep apnea? What is CPAP? We hear there's a lot of advertising done by manufacturers of those devices. What do they do, and how is your proposal of a device, an oral device, different or maybe better than that?
Well, We know, the medical community, dental community knows that CPAP is 100% effective. It will help.
What is that? What do the letters mean?
Continuous positive airway pressure. So the CPAP machine is forcing the air down your throat, and the force of the air keeps the musculature out of the way. And then in the oral appliances, we are moving the mandible so that it is forward. The mandible is your lower jaw. We're moving it so that it opens the airway. So one forces air down the throat, and the other moves the tongue so the air can move on its own down the throat. And it is 100% effective, in most cases, the CPAP. But people don't like to wear it. It's cumbersome. You have to lay on your back. You have a hose coming out, and a mask on your face and a headgear, and you're connected to electricity. It's kind of cumbersome. It does work, but it's just cumbersome.
And is that I had a guest once at my house who had one. It was not very well. I would say for him it was probably very noisy, but I'm sure he was used to it. But it's a constantly running machine, right? It's on.
Constantly.
You're hearing it.
Yes, and it has a little hum to it. They've gotten much better over the years in that they don't have quite as loud a noise in it. And my goodness, if you've been a victim of this disorder and you haven't slept and you wake up unrefreshed, you don't care what it sounds like.
Talk a little bit about the dental field, Angela Lunn. There were maybe 20, 30 years ago, 300 or 400 dentists in Chattanooga. Now there are probably double the number. Is there an oversupply of dentists? Why are there so many? Is that good for the listener, for there to be so many options in the dental field?
Well, yes, there are more dentists than there used to be. And I think in this area, particularly because Chattanooga is such a desirable place to live, is why we have a lot of dentists. But even though we have a lot of dentists, only 20% of the population seeks dental care. So there are plenty of patients. We just need them to come in.
What is your take on the question of fluoridation of water, Angela?
I think fluoride is very helpful. I think it's necessary in water. I don't think that it causes any long-term harm nor short-term harm. I think not having it causes more harm because we see tons of children with cavities.
Well, are there ways that the parents of those children could fight the prospect of erosion of teeth other than fluoride in the water, which is a mass solution to a problem that affects very young children, which are a very small subset of the overall population?
Is there an alternative? Is that what you're asking,
yes.
David?
For moms and dads who have children
that don't have fluoride in their water, yes, you can purchase fluoride through your pharmacy or through your dentist. But I do recommend fluoride even for adults. It helps with sensitivity. It helps with decay. I think it's a wonderful.
Well, let's get back to we're talking. This is David Tulis. We're talking with Angela Lunn, who runs a dental practice with her husband Riley, and she has a specialty and that is dealing with sleep problems. And we're asking about sleep apnea, which is a condition which affects many men, and they don't know that they have it. And what again, Angela, for the listener who's just joining us, what are the symptoms of sleep apnea, and how can my listener, if he's maybe he's not married, doesn't have a partner in the bedroom with him, to say, hey, you seem to have some distress every night. What are the symptoms that he by himself, without external report, can hear that would suggest he may be having problems that stress him? What are the signs and what are the stresses?
Okay, first of all, one sign could be snoring. The biggest sign that we see in both men and women is just sleepiness. You don't feel refreshed upon waking, and you feel like you went to bed early and you got a required amount of sleep, but you just do not feel refreshed. Depression, that can be a sign. Also, exhaustion, memory loss, weight gain, loss of libido. You're just not fun anymore. You don't have the oomph that you used to have that made you exciting. You're just kind of sitting on the sidelines.
So my listener thinks if I just drink more coffee or Red Bull in a can, that's gonna solve my problem.
No, it's not for long term. It's not going to. We have requirement of sleep each individual does. And we need to go through a certain number of sleep cycles. We don't just sleep one way. We have different cycles that we go through. And in those different cycles, there are things that go on. Your chemoreceptors, your neuroreceptors are working. They're helping you to build strength. They're helping you to clear out your brain. They're helping you to increase your memory. So you must get the appropriate amount of each sleep cycle. There's not just one way to sleep. And some people are woken up by coffee in the morning. That can help a little bit. But if you have to chronically drink coffee, it's a habit. And what is it a habit for? Is it a habit because you're sleepy, or is it just a habit because you like to drink the coffee? So ideally, we want to get 5 90-minute cycles of sleep. So that's about 7 to 8 hours of sleep a night per person. If we don't get that much sleep, then our cycles of sleep are interrupted. Even if you only get 6.5 hours rather than 7.5 hours, your sleep cycles are interrupted. So you may not be reaching this necessary cycle of REM sleep, which helps refresh you and helps your memory.
Is the REM sleep at the end of the period?
It's at the end of a cycle. You can think of it as like little peaks. So you're going up a mountain and you're in different stages, and then you hit REM, and then you start going back down through the different stages. And you start another cycle where you're going up on the stages. You hit REM, and then you're going down. So if you never hit that REM, you never get that sleep that really refreshes you.
REM is rapid eye movement sleep.
Correct.
And that's when you have your dreams.
That's when you have your dreams. So you may not be dreaming. That's another cycle.
Now, sleep apnea, does that interrupt the up and down cycles? What does sleep apnea do to that rhythm? And what does sleep apnea chop out from those essential parts?
Okay.
Angela.
Let me compare two things. I think this will help you better understand, David. There's an area called sleep disordered breathing. Okay, we can have snoring, which is a partial obstruction, or we can have apnea, which is an obstruction causing no airflow. In snoring, you're still partially have airflow. In apnea, your blood oxygen level goes down because it's cut off. Your body goes into fight or flight. So you're trying to breathe. You're and you're probably, if there's someone in the house, they can see your chest caving in when your body goes into fight or flight. And it just doesn't recover properly because you have not gone through all the cycles.
And when you're sleeping or you're trying to sleep, you are actually unaware that this is happening. You, my listener, are unaware that this is happening.
Correct.
And so every breath is a fight or flight occasion that your body is having to account for and stress itself.
Correct.
Over.
It's stressing itself over and over again. And that has great effects on your heart, on your metabolic system, on your breathing. It's just you're unaware of the problem. People around you are aware of it, and that's one of the issues. Is that the person that has this is in denial because a lot of times they don't physically see what's happening to them.
Well, what age does this happen? How old does my listener have to be before this kind of apnea problem hits?
You could be an infant. I see 20-year-olds that have this, 30-year-olds that have this.
If you're 50, you're more likely to have it than if you're 20?
Yes. In your 30s, men have, there's about, I'd say, 30% of men and 4% of women have it. By the time you're in 50, if you are snoring and you haven't addressed it, then you're going to have a great increase. You're going to have 60% men that have apnea and 40% of women that have apnea.
This is David Tulis. We're talking with Angela Lunn. She's a dentist. And I'm holding in my hand for the viewer on Facebook a plastic set of jaws, an upper jaw and lower jaw. And the surrounding each teeth, set of teeth is each curve of teeth is a mold shaped like them. And connecting the jaws is in this one example here, where there are two pivots, and then there's a kind of a rod between them. And what this does, as Angela has just explained to us, is push out the lower jaw so that the occlusion, the blockage of my listener's air pipe is reduced or eliminated. And this way you can breathe through the night with this and end a problem. This is an alternative solution to the CPAP regime, which is expensive, noisy, and requires cleaning and has seems to have many objections to it. Angela, thanks for joining us.
Thank you.
Angela Lunn has solutions in this direction, and that is of sleep problems. Ask your wife how you're doing, and if you have bad sleep apnea and have not addressed it, you, my listener, the man who matters, need to think about it now and get a sleep test. Go to your physician, sleep test, and then try possibly, or come to Dr. Lunn, and she'll direct you to a physician that can help you with a sleep test and a diagnosis, and then she can help you with this remarkable device. This is David Tulis, thinking about local economy of your markets. Love your neighbor and buy local. David Tulis. Check out Nooganomics.com today.
The Tennessee Valley's news, talk, and sports leader, Nooga Radio.